Welcome back. You're watching Newslink on ENCA. Well, we've heard from senior medical professionals and health officials, but often flying under the radar are frontline workers who arguably spend the most time with COVID patients. And these include our junior doctors and interns and nurses. And many of them often pull shifts of up to 32 hours. Well, one medical intern at a public hospital is attempting to lift the lid on the challenges he and his colleagues face. Dr. Kapil Narain has started a captivating series titled Breathless, in which he documents the experiences of these healthcare heroes. Dr. Narain, thank you so much for being brave enough to make this documentary and to document what you and your colleagues are going through. We haven't been able to speak to any junior doctors, and you really are the ones who are sitting with these COVID patients, trying to help them and doing the really tough work.
Thanks, Annika, very much, and good day to all the viewers.
Dr. Narain, tell me what it's been like since COVID broke out for you as a young doctor. Describe your day to me.
So COVID has really made things tough for especially junior doctors, everyone, families, fellow colleagues. It really has taken a toll on the mental health of frontliners, especially junior doctors who have to pull, as you've rightly mentioned, immensely long shifts. On a daily basis, one attends meetings, usually morning meetings. Then we'd see our patients, do ward rounds, and then have this checked with the senior. Often we'd be on calls where once every 4 or 5 days or so, depending how a roster is set, where you'd spend, start 8 in the morning and work the next day till 10, 12, or even later continuously, seeing patients. As the junior doctor, as the frontliner, we are the first ones to see patients, clock them, examine them, take the blood, order investigations, and thereafter, then review with the senior. And it really has become challenging. And speaking to many of doctors, fellow junior doctors in Gauteng as well, they're really going through an extremely tough situation. It's just been insurmountable and absolutely challenging, not only mentally but physically as well. And this is the reason why I really wanted to share the plight and the struggles of frontliners. As we know, there's a lot that has been out there in terms of the media, but it's mostly been from senior academics and professors and departments of health and professional organizations, which is needed. But those who are at the coalface, those who are at the front lines, those who are the first point of contact between those patients who are gasping for air, who are breathless, those patients who are coughing and suffering, it's frontliners. And I think more needs to be done to hear from their experiences and their struggles. And hopefully this will encourage the public to also not only gain an appreciation, but most importantly, adhere to the public measures in order to control this pandemic.
Doctor, when you lose your first patient, I understand that it's always pretty traumatic, and you go home and you feel upset, but you're losing so many patients all the time. How does that impact on you, or do you just blank it out and become almost numb?
It's extremely difficult, especially when coming across your first death, especially when you're involved in trying to resuscitate a patient. And it really does take a toll on your mental health, especially being repeatedly exposed to patients who are chronically ill, terminally ill, and who eventually, unfortunately, in some cases, demise. And going through that process, in fact, makes one unfortunately desensitized to some extent. It makes one mentally numb. And this doesn't just start as a junior doctor, but even going to the extent of when we start our medical training as medical students in hospitals. So it does really take a toll on your mental health, and it really, incessantly gnaws at the very fabric of your mind when you think about those patients who demise, and you wonder what more could you have done, and you try to console yourself by saying, you did try your best, and unfortunately, that has been the result. And you try and not make it affect you and management of further patients, but it does really threaten your health. And as a result of this, we see a lot of doctors going through burnout, anxiety, and depression, much more, than the general population.
Doctor, thank you so much for that. I think the name of the documentary is so appropriate. Let's take a look at what you've been making in the past few months.
The following is an interview conducted between two junior healthcare workers from South Africa during the time of the third wave of the COVID-19 pandemic.
We will tell the narrative and tell the story of COVID-19 and how it wreaked havoc within our hospital facilities, because we see these patients every day, we miss them every day, and we carry the burden that is of COVID. You're having to miss a patient today, and tomorrow they're just as free and they pass on, and you have to continue to the next patient without even internalizing or taking in the fact that you've just lost the patient.
In terms of the government, I think, the support hasn't been that much, because you know that a third wave is upon us, and there's a need for making sure that hospitals have the capacity as well as health workers are equipped, because we are human after all, and fatigue does set in, which means that at a point, if health workers do get sick, then it's going to be an issue, because already the health workers that are currently in the system are overworked, systems are understaffed. So I think there is room for improvement in terms of what already is being done by.
Well, that was an excerpt from a documentary called Breathless by Dr. Kapil Narain, who is a junior doctor, and just such a heart-wrenching moment there that we saw from his clip. Well.